So here we're going to be making foam for sclerotherapy using 1% polydocanol. Polydocanol is sold by the brand name Sclera. We have some 2 cc's of 1% polydocanol here. What we're going to do is transfer it to a 10 cc syringe, and then we're going to have 6 to 8 cc's of air in another syringe, and we're going to combine those to make foam for sclerotherapy. So first we're going to start just by making room in here and transferring the 2 cc's of the medication, which I had drawn up earlier, and squeezing out any of the air here, so you have 2 cc's of liquid there. You can combine the liquid with essentially 1 part liquid to 3 to 4 parts air in order to create the foam. We have a 3-way stopcock here. So what I'm going to do is just connect the syringe with liquid to one side, turn the off valve away, go ahead and draw up, in this case I'm going to use 6 cc's of air, about 3 parts to the 1 part here of liquid, and connect that through. So now the open channel is between the 2 syringes. What I'm then going to do is actually twist the off stopcock a little bit, maybe 10-15 degrees over, so that the channel between the 2 open syringe channels becomes a little bit tighter and creates smaller bubbles. We want these bubbles to be as small as possible. And then I'm going to pump this back and forth about 20 times before we get ready. When I'm with a patient, what I'll do is I'll actually go ahead and attach, it's called a scalp vein. Some people call this a butterfly needle. It's a 27 gauge needle, and that way we'll be ready to treat. So we'll have that ready and uncoiled. And then all you do is pump back and forth using the Tesari technique. So you can see right away what you get is an emulsion of this water and air creates a foam. And we're going to do this back and forth at least 20 times. And you can see how nice and thick that foam is. Okay? If you leave this sitting for about a minute or so while you're putting in the vein or getting some other things ready, you'll find you have to recombine the foam and air, or just pump it back and forth a few times. So once that's done, I'll turn the closed channel to this now empty syringe. And I'll go ahead and prime the scalp vein. You can see the foam going through. And then for the patient here, what we would do is turn this to off, and I would use this now open syringe and empty to draw blood while putting the needle in the vein. And then once we hit it, go ahead and switch and pump the foam into the vein. And that's how you make foam.